Menopause marks a significant transition in a woman's life, with a host of physical and emotional changes accompanying the end of reproductive years. Along with symptoms such as hot flashes, night sweats, and mood swings, menopause can also influence a woman's cardiovascular health. Despite the potential benefits of hormone replacement therapy, many women are hesitant to seek therapy due to concerns about cardiovascular side effects. The fear of increased risk for heart disease or stroke can be a significant barrier to considering HRT. It is essential for women to discuss these concerns with a healthcare provider who can guide them on the latest research and recommendations. Properly managed and individualized HRT can be both safe and beneficial, particularly when the potential benefits outweigh the risks. A recent study published in JAMA sheds light on the relationship between menopause and cardiovascular risk, offering insights into how HRT may play a role in managing these risks. The JAMA study investigated the effects of menopause on cardiovascular risk factors among a diverse group of women. Researchers examined the changes in blood pressure, cholesterol levels, and other cardiovascular risk markers as women transitioned through menopause. The study found that menopause can lead to changes in these markers, potentially increasing a woman's risk of developing cardiovascular diseases. While menopause itself is a natural process, its impact on cardiovascular health is significant. The study's findings emphasize the importance of monitoring and managing cardiovascular risk factors during this stage of life. This is where hormone replacement therapy may offer potential benefits. Hormone replacement therapy, or HRT, involves the administration of hormones to alleviate menopause-related symptoms and potentially mitigate the associated increase in cardiovascular risk. Estrogen and progesterone therapies can help regulate hormonal imbalances and may have a protective effect on the cardiovascular system. However, the decision to pursue HRT should be individualized, considering a woman's health profile and preferences. This JAMA study highlights the importance of addressing cardiovascular risk during menopause and opens the door for potential interventions such as hormone replacement therapy. For women considering hormone replacement therapy, PrimeBody offers a safe, convenient, and effective solution through telemedicine. The platform connects individuals with experienced healthcare professionals who specialize in hormone therapy. Through virtual consultations, patients can discuss their symptoms, medical history, and treatment options with qualified experts from the comfort of their own homes. PrimeBody provides personalized HRT plans tailored to each woman's unique needs. Medications are prescribed and delivered directly to patients, ensuring a seamless and discreet experience. By leveraging telemedicine, PrimeBody eliminates barriers to access and empowers women to take control of their health during the menopausal transition. Visit PrimeBody.com to get started.